Hey there. In healthcare, we've got all these amazing tools for diagnosis and treatment, right? But today, we're going to talk about a tool that's often overlooked, but is absolutely critical for patient safety: communication. We're going to break down how language isn't just some soft skill, it's a precision instrument that you can and should master. All right, let's get into it.
So let me ask you something. When you think about your entire clinical toolkit, everything from a stethoscope to a scalpel to a high-tech scanner, what's the one instrument that's both the most powerful and, honestly, the most often overlooked when it comes to keeping patients safe? That's it. Language, it's just one word. But in a clinical setting, wow, a single word can be the difference between a correct diagnosis and a major error, between a patient feeling reassured or terrified. It can literally be the difference between safety and harm.
And that gets us to our first big point: why precision with our words matters so much. In such a high-stakes environment, any kind of ambiguity is a huge risk. Every single word you hear from a patient and every word you say back carries enormous weight. I mean, just look at this quote. This is a daily reality, isn't it? A patient says they feel funny, and right away, your job is to become a translator. Are they talking about vertigo? Are they feeling faint? Is it a neurological symptom? The entire diagnostic path splits right there, all depending on how well you can clarify that one single vague word. Okay, so let's zoom in on that patient encounter, because this is where everything really starts. This is where language is used to build the very foundation of care. And that foundation is trust. It's not just about extracting information, it's about building a real partnership with your patient. You know, a really powerful technique here is something called signposting. Think of yourself as a guide, leading the patient through what can be a scary and confusing journey. Using simple phrases like, okay, first I'm going to ask you a few questions, and then next we'll talk about what might be causing this, and finally, now let's go over our plan together. It gives the conversation a clear structure, manages their expectations, and you'd be amazed at how much it can lower a patient's anxiety. And this four-step structure, it's an absolutely fantastic tool for creating that clarity, especially when you're explaining a procedure. It makes sure you hit all the crucial points, one by one. You explain the what and the why, you walk them through what it will feel like, you cover the risks and benefits, and then, and this is the most critical part, you close that loop. You check that they've understood you. This isn't just good manners, it's the absolute bedrock of informed consent. All right, let's shift gears now. We've talked about speaking with patients, but what about writing to our colleagues? The professional handover, whether it's in the patient notes or a referral letter, is another one of those moments where precision is everything. Just look at the difference here. It's night and day, isn't it? The unclear note is, well, it's pretty useless, and honestly, it's dangerous. The clear note, on the other hand, is a masterpiece of efficiency. It uses the correct tense, making a clear distinction between what's happening now versus their past history. It's specific, it's concise, and it has a very clear call to action. This is the standard that keeps patients safe and ensures care continues seamlessly. And believe me, the mistakes in that first note are incredibly common. Things like using the wrong tense can totally confuse the timeline of a patient's condition. Vague phrasing just leads to guesswork. And even something that seems small, like misusing articles, versus the, can create confusion, especially for a colleague whose first language isn't English. Getting this right isn't about passing an exam. It's a fundamental professional responsibility. You know, all of this takes us beyond just the technical parts of language. It really speaks to the entire culture of care. Because great communication isn't just about picking the right words. It's about the empathy and the principles that guide how we use them. A huge principle here is using plain language. And let's be clear, this has nothing to do with dumbing down information. It's actually an act of respect. It's about making sure your patient, who's probably already stressed and not feeling well, can understand vital information the very first time they hear it, without having to go look up terms later. And right alongside that is cultural sensitivity. It's so important to recognize that a patient's background can shape how they think about illness, about authority, about treatment. When you adapt your approach, you're showing respect. And that's absolutely fundamental for building the trust you need to provide effective care. So when you boil it all down, all of these skills, the precision, the structure, the plain language, the empathy, they are all driving us toward this one single number: 0. That has to be the goal. 0 ambiguity, 0 confusion. When someone's health or even their life is on the line, that is the only acceptable number of misunderstanding.
So let's pull all these different threads together. Mastering these communication skills is really what takes someone from being a competent practitioner and turns them into a truly complete clinician, someone who doesn't just excel at diagnosis and treatment, but at connection and communication. And it really comes down to these 4 pillars. You need clarity when you speak with your patients. You need precision when you write to your colleagues. You need empathy in every single interaction. And those first 3 pillars, they all exist to support the final, most important one: safety in your practice. You really can't have one without the others. So I'll leave you with this last thought. Getting better at communication is a journey. It's not a final destination. So looking at these 4 pillars, I want you to ask yourself, which one of these skills will you make a conscious effort to focus on tomorrow? Because every tiny improvement you make in your language can make a huge, huge difference for your patients.